ascending aorta, aortic arch, descending thoracic aorta, descending abdominal aorta. Brachiocephalic trunk, left common carotid artery, left subclavian artery, vertebral arteries on the anterior side. Here's the common carotid, here's the subclavian, here's the common carotid. Kind of hard to see the split. Here's the external, external and internal carotids right here, right here. Make sense? External goes outside the head, internal goes inside the brain, right? Here's the left subclavian artery. Left subclavian comes to about right here where you start seeing the little branches. This is the axillary underneath the armpit, which goes up until the loop right here. After the loop, we go into the brachial, which will split into the radial and ulnar, radial lateral, ulnar medial side, and go into the palmar arch. Good? Okay. Mammary artery, intercostals, abdominal region. Do your best. If you can't get in there and get a video, it's fine. You got it from before. But the first trunk to come off the descending abdominal aorta is the celiac trunk. It's like straight flat like this. So even if you get in there, you can't really see it. You have to look at it from the side. You can kind of see it over here. Celiac trunk will split into the hepatic artery that goes to the liver, splenic artery that goes out to the spleen, and the gastric artery, which is a loop that goes around the stomach. Just the top loop. This is something else. Don't worry about that. That's you don't have to know that one. Top one. Okay. That's the first trunk that comes off the descending abdominal aorta. The next trunk is right here, 93. This is the superior mesenteric artery. And then you have this one on the side, the inferior mesenteric artery. If you look closely, right here, number 100, we have two of them, one on each side. Those are the gonadal, ovarian, or spermatic arteries. And those go down to the gonads. On the posterior, we can't see the lumbar, but we can see the renal arteries right here, and we can see 79, the inferior phrenic. Inferior because it's coming from underneath up to the diaphragm. Good? When we split into legs, we split into the common iliac arteries. Common iliac splits into external and internal iliacs. External iliac, internal iliac. External iliac comes down, goes into the femoral artery, which has a branch, the deep femoral on the posterior. Femoral goes down into the popliteal, where you have the branches come off, which goes into the tibia, anterior tibial on the front leg, posterior tibial on the back medial side, and fibular on the back lateral side. The anterior tibial and the fibular will loop into the dorsal pedis arch. The posterior tibial will go underneath the foot and go into the plantar arch. The dorsal pedis arch is always the circle. Plantar is always the toes because it goes underneath. Questions with that? Good?
Artery again. Do we go to the one?
Yeah, right?
Yeah.
Which is subclavian, axillary, brachial, radial, ulnar, palmar arch.